So this patient's coming in for a mobile mass on the right side of his neck, which is consistent with a lipoma. We sort of added the purple dot sort of around to get the margins of where we can feel it. He's had a circumferential block done through this way. In terms of incision lines, we're obviously looking for Langer's lines, which usually run more horizontally as opposed to vertically through the neck. And you can see here he has some natural lines that are developing. So this is the line on which we want to be incising upon, is here. No pain when I do that at all? No, you're fine. The neck's a little bit challenging to work with, not because of underlying structures, which we're not going to be anywhere near, so like his big veins and arteries will be spared for this procedure, but it's very elastic. That's what allows us to bend our neck. So this is, again, one of those procedures where it'll look like the scalpel's either dull or we're fighting with the equipment, and it's just because these tissues are very, very elastic. You're okay? So very similar to other procedures we do, we essentially are just dissecting down on this. Just want to get down to a level where we can sort of separate out this lipoma and then be done with that. And you're comfortable there? Nothing's hurting?
No.
So this is our lipoma right there. Is that hurting?
Oh, well, I felt the pressure there.
Does that hurt what I'm doing there?
Well, it feels like it's pulling up.
Yeah, but is it?
No, it doesn't hurt.
Not
It's
pain,
just
it's
pressure, yeah.
So that's because I'm pulling on underlying structures, so I should be able to work around that. Try that one. So the big take-home message here being, not that we ever want to be doing blind, dissection. You can do that sometimes on the superficial aspects, but certainly if I'm dealing with the neck and structures in through the neck, at the posterior end, I want to be seeing what I'm actually dissecting into. Just do that for me. So again, we should be above all of the critical structures, but that's assuming, obviously, that you're actually monitoring what you're doing and you're seeing what you're doing. Do you want to just grab the retractor there for me? Just pull that up so we can show them what we're looking for. Just retract that up for me. Perfect. So this is the bed of the lipoma. Now sometimes this is seeing with eyes of faith, because if you're not used to seeing this, but this is where, see where it's articulating with the different underlying tissue type. So that's what I'm just dissecting away from. You're still comfortable?
Mm-hmm.
Probably where you see it easiest is up through here. We can just see that those are adhesions there. And that is that. So this is just all fatty material. So you can see it's distinct though. It has a very, very thin membrane, but that's completely out. So we're good with that. So now we want to certainly check for active bleeds. So we don't want anything, and I don't think you'll have anything like that because you can tell what during the procedure. So a little bits of moisture don't bother me a little bit because that just means it'll heal nicely for us. So here again, the debate becomes, do you need to put internal stitches in? The one nice thing about the neck, so the fighting we had to do because the tissues are elastic actually help us here because these tissues want to come back together. So this isn't an area where I often use internal stitches. There's not a need for them. You want to grab me 5-0 actually?
Oh.
Just grab the bifurcator right over. No pain when I do that? Nope. So here's a good example where you want to ask about the quality of the pain. So earlier, if I'm pulling up on structures, obviously we're not freezing way posterior, so he's going to feel that, but it should have just been a pressure. As opposed to, if it's a sharp pain or it's uncomfortable, then we obviously add more freezing, because there's no downside to adding extra freezing here. There's no part of this that's infected where he wouldn't take up the freezing, so we would just continue to inject until he actually has relief of pain. But as an example, had I injected more freezing with that complaint of the tugging, it wouldn't have done anything for that sensation, because that would have been very deep. And in the neck, when you're pulling up on structures, he'll feel that just a little bit. But it should just be like a tugging sensation and not uncomfortable for him. No, that looks good. Good. So here again, this will be because of the elasticity of the tissues. It'll fight you a bit if you're putting your stitches in. And working in the crux of the neck is like working between the fingers. It's hard to pull in all the directions you need to, because you end up hitting his shoulder or you hit his head. Not impossible, but you just have to learn to how you wrap the actual extra thread, how you actually pull on it, pulling it in a slight direction just because you want it to lay flat, but you have to put enough pressure on it to get it like that. And the goal of all stitches is we want the tissues to oppose across the basement membranes, so we don't want the tissues to be buckling. So this is where you see me sometimes push down. See here, I want that to be in a little bit. And sometimes I have to correct that after the stitch is in, but doing it during and afterwards. Just have that fine. You're still comfortable?
Mm-hmm.
Almost done. Jump a little light over here. It's too late, don't worry about it. Just there's nothing much shadow behind me.
Yeah, the position of that weight did nothing.
But at least it only did it for the whole procedure.
Yeah.
So that alignment looks good. So I'm just going to be going through and pushing down on that just so I can make sure that that's aligned perfectly. And then we'll put a dressing on that. Looks good. All right, so we'll see him back in about probably a week.